I can often tell what medication a patient's on before they even sit in my chair. If I hear a dry, persistent throat clearing, even from the waiting room, the kind that sounds like somebody's trying to dislodge a tiny invisible thread, I almost always know I am hearing an ACE inhibitor cough. It's a classic local legend here in Singapore. But the good news is that you don't have to live with that cough. There's a more refined version of blood pressure medication called the ARB. Think of it this way. Your body sends out a tension signal that tells your blood vessels to tighten up. Now, while older medications try to stop that signal from being made, an ARB works very differently. It simply unplugs the receiving end. So the signal is still sent, but your blood vessels never receive it. Now they stay relaxed and your pressure stays down. Because this unplugging happens at the very end of the line, we don't mess with the pathways in your lungs that cause the phantom tickle. It's the same gold standard way of controlling your blood pressure, just without that tickle in your throat. In cardiology, we often call these clean medications. They work incredibly well and they are incredibly well tolerated. For my patients who have spent months and sometimes even years apologizing to others for a cough, either in their meetings or during dinner, switching to an ARB feels like a massive weight off their shoulders. Now, full disclosure, you might feel a bit lightheaded for the first few days, and that's just your circulation getting used to a life with less resistance. Now, even though these are smooth, we still have to be careful. And during the first few weeks of the switch, maybe first 2 weeks, I'll ask you to track your blood pressure at home, and we'll also check your kidney markers. We're just making sure that the medication and your unique biology are in harmony. Now, one tip for my active patients, you want to avoid those heavy anti-inflammatories like ibuprofen when we are trying to adjust and stabilize your numbers. They tend to interfere with what we are trying to do here. Now, I don't prescribe an ARB just to check a box on a chart, and I prescribe it because I want your health to be invisible. I don't want you to go to sleep or travel without constantly being reminded of your medication side effects every time you try to speak. It's about a heart that's protected and a life that is uninterrupted. I'm Dr. Peter, and let's find the right harmony for your heart together. Have you been toughing out a cough for too long? Let's talk about the alternatives in the comments.